Everybody's got a body, and I know bodies. Living in this body is something we've got to do every single day, so we may as well master it. I'm your host, The Good Dr. Dave, and this is the Health Mastery Café, your #1 brew spot to master your health. And today, I'm really excited. We've got Professor Dan Ariely on the show, y'all. Wait till we dive into this content on his book, Misbelief: What Makes Rational People Believe Irrational Things.
Next on the Health Mastery Café.
Hey, it's Dr. Contessa, and you are watching the Health Mastery Café with Dr. Dave.
Hey, cafe connoisseurs, you know how I always say we have the absolute best guests on the Health Mastery Café. My power producer, Nicole Andrews, has knocked this one way out of the park. I cannot wait to introduce to some and present to very many others Dan Ariely. His name's going to be familiar to a lot of you. Dan Ariely is the James B. Duke Professor of Psychology and Behavioral Economics at Duke University. He's a founding member of the Center of Advanced Hindsight. He's also the co-creator of a very neat documentary called Dishonesty: The Truth About Lies. I came to know Dan through TED Talks. It turns out that his 7 or so TED Talks have over 27 million views. Remember, long form, 27 million times. If we're sitting down watching 27 million times, he's got something to say and people are listening. I can't wait for you to hear him. He is 3 times over a best-selling author, New York Times best-selling author. And the book that we're going to talk about today, I know, is going to be one of those bestsellers as well. It's called Misbelief: What Makes Rational People Believe Irrational Things. I know we've all thought about that, had that question, particularly around the last 4 or 5 years. It could have been even before that. And we're going to dive into that with the professor today, Dan Ariely. Thanks so much for being on the cafe.
Lovely to join you.
I really appreciate your time, Dan. This is fantastic. Listen, the way that we start the Health Mastery Cafe, Dan, is by asking, what's in your cup? It's a cafe after all. Well, my cup right now is water, but I am a coffee guy. I drink a little bit of green tea now, not for the taste, but for the antioxidants and other phytonutrients. Tell me what's in your cup typically, Dan.
So I have 2.
Yes.
I have coffee and I have water. This is the second cup of the day. My coffee machine broke about a month ago. I have an espresso maker that broke and I did not have time to fix it. So this is pour over coffee.
Yeah. Well, at least you got your caffeine. I'm there with you. I'm already caffeinated. This is going to be a fantastic conversation. So I want, before we dive into the serious stuff, I really want people to hear the conversation about misbelief and what makes rational people make irrational choices and believe irrational things. I want you to please, just for the record, resolve the perennial issue for us. Should the toilet paper be over or under? That's the question.
I'm very happy we're starting with important things. My version is under. I think there's really no question about that. And I think anybody who's saying else is itching for a fight.
Yeah. Well, you know what? I would typically not argue with my guests on the first part of the podcast, but I have to say that over is the only way to be. Like, what are you doing with it under? You have to, you're swiping it, things are going across the... Totally rational, come on.
It's totally random, but, it's kind of a good analogy to the fact that everything is becoming polarized.
Yeah,
and that we don't, there's so many things that we look at and we say, that other person is broken in some way. How could they possibly believe something else? And, there are things like, I think, preferences for colors. Somebody likes green, somebody likes orange, that we're kind of okay with. But there are way too many things that we make into issues of identity and we start debating. And they're getting worse and worse in this country. The number of parents these days who would not want their kids to marry somebody from the other political aisle has been growing steadily, and it's a very high number right now. And that means just we not want people. So toilet paper is not yet divisive issue, but I can, as a joking matter, I can easily imagine how it would become quite quickly.
Yeah, yeah. Well, and that's a part of the reason why I said it, because I think you make such a cogent point in the book of how things that you would imagine, or in times past, decades past, we would never become enemies around, right? You can have strong views about, but we don't have to have animus and venom. But you make a point that that's where we are. I think people are seeing that more and more. Why do you think that is? Why has it turned that we have to be enemies, right? Right? Duke and UNC. Come on, you can play each other, right? And not, well, we hope that you could play each other and not hate each other's guts, right? Tell me, why are we there? Why are we at a point where we have to hate each other?
So maybe we should start a little bit back, because it's kind of built itself, the social element. So, I during COVID, I basically found myself helping lots of governments. I'm a social scientist, but there were lots of social science questions.
Yeah.
How do we do remote education and remote work? And how can the government compensate people who are out of work? What do we do with domestic violence? Getting people to have new ways of living, sanitizing our hands, washing our hands, wearing masks, and so on. And quite a few months into it, where I'm doing nothing but COVID, and I feel I'm as helpful as I can be, I get an email from this woman that says, Dan, what happened to you? How have you become this person? And I write very quickly back. I say, what do you mean? And I get a long list of links. One link has a video, and the video says that when I was young, I got burned in 70% of my body. True, most of my body, the reason I don't have hair on this side, most of my body is covered with scars. It then went on to say that I spent about 3 years in hospital, also true. And then it went on to say that because of that, I started hating healthy people. And that's why I joined Bill Gates and the cabal and the Illuminati to try and kill as many people as possible with the pandemic and then with the vaccine. And there were many other videos like that.
Yeah.
And there were discussions, there were lots of things. And when I saw this, my first instinct was to try and fix the impression of those people. And for about a month, I tried to have conversations and discussion, face to face, online, all kinds of ways. And I basically failed miserably. I could almost not convince anybody. But at the end of this month, I realized that the problem of misbelief is bigger than what I thought and more important. And I decided to try and dive into it. And this book is really the story of trying to understand this world in which 5 years ago we would look at somebody else and we would say, me and this other person see the world in the same way. And now we look at it and we say, who are those people? Yeah. How did they come to believe what they believe? How can they look at the same thing and come up with such different conclusions? And the starting point, I basically divide this process into four. There's the emotional element with stress. There's the cognitive part in which how we look for information. There's the personality part, and there's a social. And you asked about the social element, but I want to wait with it until we get further.
Yeah.
But you must see in your own practice the ramification of this, right? Where you get people who basically come to you and now they probably trust you, but maybe they don't trust pharma, they don't trust the research process, they don't trust the FDA. And I don't know what you do to overcome those misbeliefs, and because at the end of the day, society runs so much on trust.
Yeah.
We have trust that the elevator we take was inspected, and that the food we eat is safe, and the medication that we have were created the right way, installed the right way, and given to us, and the people who take care of our kids. Just the amount of trust is incredible, but we're losing it. We're losing trust, and uh, we're losing people.
Yeah, well, yeah. No, go right ahead, please.
So maybe the first part of the discussion is the recognition that the building block for misbelief is stress.
Right.
And I don't mean stress.
Stress of not knowing, for example. That's one of the big ones, right? I think with COVID, there was this large void. Nobody really understood it. We had some scientists who understood the first variant of SARS, but we didn't understand CoV-2. And I think people, and you talk about this a little bit, the vacuum, I think it's humans' natural tendency, correct me if I'm wrong, to fill a vacuum of information. I feel like that's what we did. And one of the things that I have said publicly on news and different places is that we as professionals, healthcare professionals, we dropped the ball. We allowed people with misinformation, bad information, and bad actors, because there are some. Not everybody's a bad actor, to your point. They're just people that have bad information, to usurp the conversation. And we went on defense, and that wasn't good enough. In this particular game, in the game of information, I think offense wins games, not defense. We still are not saying to the society, where our ever widening gap of trust is occurring right before our eyes, we still haven't said, hey, listen, we made some mistakes. I remember going on a show called Sister Circle in January of the pandemic, before everything shut down. And I had listened to Anthony Fauci, and Anthony Fauci says, no, don't use the masks. Let's let the healthcare people use the mask where it's needed. Well, we've never really had anything where we had to broadly wear masks, and it made sense. I went on Sister Circle, as I had been doing on television, the years before, and whatever the sort of leading guidance was, I was sort of echoing that, right? And I went on and I told the thousands of people watching that, and the thousands who watched it after it was broadcast, don't worry about it. There's more problems with people dying of flu. You don't have to worry about a mask. Now, that was wrong. We eventually saw that was wrong. It's not fomites. Fomites what? Like, how was this thing spreading so quickly if it was just fomites? It obviously was airborne, and it started to make sense to people. We didn't stop and say collectively, right? At least where the public is, society is. We made a mistake. We thought that this was a sort of a surface issue, that you could just wipe the surface of the table and put it in your eyes, your nose, or your mouth, and you get it. We were wrong, but this is why we were wrong, and here's now what we know. Now, guess what? If you put me on the nightly news, or whomever, of course it wants to be me, right? If you put me on the nightly news, and I say that to the American people looking straight at them like this, guess what happens? Now they say, oh, I see he made a mistake. He's a human being. Name one human that's not. Well, we weren't taught to talk about that. Like in the medical profession, you are not taught to go and tell a patient or your colleagues that you made a mistake, right? So now it looks like it's underhanded, that we're hiding something. And then we widen this trust gap. We have not atoned from the problems and the issues that we caused in the past. Now we've got a new one. We're dead in the water. So instead of then jumping out in front, we get people on all kinds of podcasts, on all kinds of everything. They think they're doing the right thing. Listen, folks are not out here trying to deceive people. They literally, somewhere in their minds, think they're doing the right thing. We knew it wasn't right based on what we knew, but we didn't go on offense. We were backing up in defense. Oh, let's do a zone deep. That doesn't work, obviously. And I think that's part of it.
There's a couple of things about this. One is that in the early days, we didn't also express enough humility in what we thought was going on. So it was one thing to say there's no masks needed, but what people should have said, we have very little data, we don't know, but currently it looks like this is the direction.
Yes.
And when people are like, I understand the news, everybody wants a soundbite, everybody wants to be helpful and so on. But whenever you have a long-term gain, when things are going to last for a long time, you really have to think very carefully about trust. And we should have thought about this more earlier and basically say, we don't know yet. It will take a long time to know. And by the way, with population health, it's so difficult. Like by the time we understood whether surfaces are infectious or not, it took a really long time.
Yeah.
The other thing about your comment about doctors not admitting mistakes, there's some actually very nice research showing that when doctors make mistakes, like real mistakes, like, making the wrong surgery, like terrible mistakes,
yeah,
when they admit it, they get sued less.
Right.
And, it's because we all understand people. We've all have been wrong. If somebody says that they're sorry, that they're wrong and they're sorry, we have this tremendous capacity for forgiveness. But lawyers tell us never admit anything, never say anything. So now if I'm a patient and a doctor made a mistake and they're not admitting it, it's so annoying that we do this. But going back to this issue of stress, so COVID, lots of unknown, strange things are happening, this virus, China, and then you have on top of that, yes masks, no masks, yes surfaces, no surfaces. All of this is very, very confusing. And people need a story. We need a story to understand what it is, what is going on. And the story helps us because the story gives us a sense of control. And in the world of health, by the way, people have very little control. I remember when I was a patient in hospital, the only thing I had control over was when I will get my next morphine injection.
Right.
I had a fixed amount of morphine. This was before the patient control analgesia. So but they said, you tell us when you want it. But that's the only control I had, right? You can't decide when to wake up and what test to do and when are they going to take the bandages off and nothing. But it's so important to have some control. But anyway, stories about what's going on give us a sense of control. Okay, I understand the world. I understand what's going on. By the way, in health, people get all kinds of illnesses. Why did I get? What did I do? What's happening? Where is it? It just gives people a sense that they know what's going on. Because if we don't have a story, like what will happen next? And by the way, this is also connected to superstitions. If you think about superstition is a way to control things.
Yeah.
Right. To think that we control.
So what you're saying is filling that information void, that gap, is a mechanism for gaining control again, for something that you feel like you don't have control. And that I don't think I've thought about in that way.
Yeah. And not only do we want to have a story and feel like we have some control, we want a story with the villain. Why do we want a story with the villain? Because then it's not our fault. Somebody else did it. And of course, with the internet out there, go on YouTube, you can find stories. And you can find stories with the villain. And then it gets worse and worse and worse. And one analogy for this, which I think is important, is to think about this like a mosquito bite. So, when you have a mosquito bite, you have a real need to itch. It's not a healthy need, but we have a real need to itch. And for people to start believing in these misbeliefs and believe that there's a story and there's an explanation, there's a villain, also responds to a real need. One of the things I learned about the misbelievers, and we should all think about the people in our lives that believe those strange things, is that they did not wake up one day and say, what would I be better off? believing in a benevolent, loving God, or believing that Bill Gates is trying to put 5G chips in my kids and make them infertile. Nobody would pick that.
Yeah. No, I saw it happen. I actually saw the chip going in. No, I'm kidding. Go ahead. Yeah. Yeah.
You're a doctor. You probably you better injected many of them.
Yeah.
But nobody would pick it. But it's a response. It's not a healthy response. It's not the right response. But we need to understand that it comes for a reason. The people who pick those beliefs do not pick them for nothing. They have this need for a story, a need for a villain, and then they go on this path. So that's the beginning. And by the way, if people did not feel stressed, and if people did not feel out of control, everything would be fine. I do want to say one other thing. I think we're at a tough period in human history where we have a lot of stress. So of course, COVID was a lot of stress, but I think the war in Ukraine and Russia, I think what's happening in the Middle East, ChatGPT and AI is creating lots of stress for young people who are basically saying, I'm just studying X. Are you sure there'll be a job to do X in 2 years? And we can't tell them, yes, we know. And not only are we living in a period of very high stress, we also live in a period of very low resilience. And resilience is kind of humanity's defense system against stress. But what is resilience? Resilience is having a social network. I'm talking about real people that you can go to in time of trouble. Resilience is about feeling that if you fall, somebody would pick you up. Resilience is the idea that if you lose your job, there'll be something from society that would help you. And we have less and less of it. At work, people are discouraged from talking about their personal lives. We're discouraged from talking about our political opinion. As income inequality is increasing, we're less likely to ask help from people. So all of this is basically mean that we have high level of stress and low level of resilience these days. And therefore, the need to find these stories with the villains is getting higher and higher.
And you became one of those villains, Dan. I know that you were working with governments. I don't know that people know this, that they asked you to consult and say, how do we convince people to wear a mask? At the end of the day, masks work. They absolutely, positively work. When we saw that people started wearing masks at the very beginning, when we started getting information about this and we started closing down, people were wearing masks, staying in, the numbers went down, 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 down. And then the conversations that I thought bordered on irrational, you might agree or disagree, came in, and we started kids don't get it. Why aren't the kids at school? That's layered. It's a layered conversation. But it didn't make sense to me after I had learned my lesson from that January, right? Don't just go say what Tony Fauci said. Don't just go say what, Sanjay Gupta said. Go and use your own brain. I had a lot of school. I paid for a lot of school. Go use your own brain and come up with some ideas that are based on, right, some biologic plausibility. And that's what I started doing. So when they said, well, kids don't get it, well, that didn't make sense. So I get on Instagram and I said, well, there's no force field. Why would a kid not get it? Well, it turns out that they did. And not only did they get it, they probably were more likely to be asymptomatic carriers. And then we started seeing MISC, multi-system inflammatory disease of children. Disaster. We didn't come out, same thing. We didn't come out and say, hey, listen, we were wrong about the children thing. Children can get it. Let's be thinking about vaccine. We didn't say it like that, right? And to your point, to just highlight that. It sounds like what we're saying is, because I would love strategies from you and things that people can do. It sounds like this gap is fueled by the lack of control. We don't understand something, we got to fill it up. but that if we're going to go on offense, the solution is somewhere in the realm of information, right? And the purveyors of information should be on offense. So I think the composite of what we're saying is, hey, let's let the folks who really know what they're saying have an onslaught of offense to get information out. Hey, if the tax code changes because Congress changes the tax code, guess what? Congress is not going to get out necessarily and tell you what to do. Who's going to tell you how to change your taxes? The tax professional. The scientists at the bench who are understanding different things about mRNA, which is, as a vaccine, which has been in study for decades, by the way. Unbeknownst to many people, hey, this is brand new, right? And then the guy's turning over in his grave because he spent his whole life developing and trying to understand mRNAs as vaccines, mRNA as treatment for cancer. Anyway, so, right, we get out and we go on offense, right? If the tax code changes, the tax professional gets out and says, this is how you do your taxes. If the science changes at the bench, the purveyors of that science, the information, the practitioners, the doctors, have to be on offense. I think that's a way to do it. Tell me what you think are some strategies that we can use to mitigate some of the misbelief, the misinformation that comes out of misbelief.
So first of all, I want to say something about the difference between taxes and medical science, especially during a pandemic when things are very unclear. And we could have known in the beginning that it will take some time to figure it out. We could have also predicted that the virus will change over the years. And I think we should have prepared for that. We should have prepared for a world in which we don't tell people, do X or do Y, but to make it more, this is what we think right now, here's the things we still need to find out and so on. But if we say the first component is stress and resilience, then what we need to do is to figure out how do we provide a lower stress environment? How do we provide an environment with some control, and how we provide resilience for ourselves and for others? This is the first part. And we can all think about the people in our lives who are the most fragile. What do we do to help them, especially in times like that? It's also true when people become ill. We talked about COVID because everybody was stressed out, but when people get sick, it's a very, very stressful situation. The next component is the cognitive component. And there's some parts of it that we all know. We choose to watch Fox News or we choose to watch NBC. People choose which one they want to do, or we choose Twitter, and Twitter decides for us which one we go for. So there are things about the way people consume information, what information we consume, and so on. There's a third element, which is the personality. Some people are more trusting of their intuition. Some people more trust science, and so on. But the last component that I want to focus on now is the social component. And we started by mentioning that, but I want to focus on that for now. One of the elements of the social component is something we call shibolet. And shibolet is a term in Hebrew. It comes from the Bible. And the story is that there were these two tribes. And the two tribes were fighting. They ended the war between them, and they settled on the two sides of the Jordan River. And the Jordan River is a very small river, easy to cross. They settle on both sides, and then they would walk around and they would meet people. And let's say I would meet somebody and I would want to know if they're from my tribe or from the other tribe. And it just so happened that these two tribes pronounced the name of the plant, shibolet, in slightly different way. One of them said she-bolet, and one of them said si-bolet. So imagine I walk around and I see you, and I say, hey, you, how do you call this plant? And if you say the name that I use for it, then we're brothers. We're from the same tribe, we hug, everything is fine. But if you use the term that the other tribe is using, Now I know you're an enemy, and I try to chase you away or do something terrible. And we now use this term to signal a discussion that is not really about the facts. We use it like, because when I show you the plant, I don't really care about the name of the plant. What do I care about? Are you from my tribe or from the other tribe? So we use the term shibboleth to indicate cases in which it seems like we're talking about the facts, what's the name of this plant, but in fact, we're talking about identity. Now, think about discussions we have in public. Think about our politicians, think about opinions. How much of these discussions are about identity and how much are they about the facts? And the reality is that a lot of it is about identity. Are we talking about abortion or are we talking about identity? Are we talking about gender fluidity or are we talking about identity? Are we talking about vaccines or are we talking about identity? You know, which was the state in the US that they had the highest rate of people who were vaccinated for COVID? I don't know if it's still the case, but in the early days.
I would say Vermont or something like that.
Interesting choice. It turns out to be Puerto Rico.
Oh, well, yeah.
And the reason is they don't have the Democratic Republican issues. Right? If you ask the question of what has prevented people from doing it, it was along political lines. And Puerto Rico has a different aspect. So when we talk about shibboleth, we talk about discussion that is really not about the thing itself, but it's about expressing identity. Now, of course, if people express identity multiple times, then they start believing it. Right? So it ends up influencing it, and then they try to say something more extreme and more extreme to portray identity. By the way, a lot of the discussion on global warming is like this. You know, when you talk to people about global warming, people have very clear ideas, and then you say, "But how did you get to your ideas? What did you actually read?" And in most cases, people say, "You know what? I didn't read that much. I trust the news resources I get. My best friend told me that. I trust science. I don't trust." I mean, people. It's. But if you ask how many people have really studied it, the answer is very.
Well, you know, it's interesting, Dan, because I get a lot of, you know, and they said, and it used to be in the times when Oprah had a talk show every day, they would say, well, I heard it on Oprah. And you would go back on the episode logs and there was no episode about it. There is, and I think you touch on it a little bit, there is this sense that if I believe it, I got it from somewhere. But when you ask people to walk through it, so you asked me at the beginning, how do you handle that? How do you handle, sort of an irrational conclusion that's not based in fact? And so I try to use Socratic type of method and start with a question that has nothing to do with it and circle around and try to do a little psychology. And as much as I think that my line of questioning was so good, and and they'll sit there and say, "Oh, yeah, you're right." And when they leave the office, Dan, they have not changed their minds about it. They have not changed their minds. Whatever it is, they might take the medicine, but they haven't really changed their minds about whatever that core sort of belief is. So I do wonder that. And I keep coming back to this offense thing because I don't have another way to express the idea. But if we don't get there first and fill the gap, how do we? How do we unearth the garbage and put the right stuff in there? I don't know what the answer is.
So the Socratic method is a very, very powerful approach. And one version that we have for this is, we call it the illusion of explanatory depth. And here is how it works. Think about, people have debates all the time. So imagine two people debating. One person talks for half an hour, the other person talks for half an hour, and then what happens in the half an hour they don't talk? You would say the person who talks for half an hour, this person would listen, and when this person talks, this one listens. But the reality is, we know that doesn't happen. We know that when we talk in a debate, we talk, and when the other person talks, we already make up the argument about what they're wrong. We're busy half an hour saying our thing, and we're busy the other half an hour arguing in our mind to defend our territory.
Yes.
And because of that, our success rate in arguing with people is very low. When you ask people how often it happened to you in the last 3 years that you talked to somebody, you had a heated discussion, and at the end of it, they said, you know what, you're right. Dave, I've never heard anybody articulate this argument
in life ever. Yeah.
Vince, thank you so much for spending this time with me. We have a very bad history of convincing people, and of course, we have a bad history of being convinced ourselves. But this approach of the illusion of explanatory depth says, don't attack people, come at it from their perspective. So I think what you're saying is, people say they have this opinion, and you say, explain to me your opinion in more details. How exactly is this working? Where exactly are you getting this information? And when people have to face that situation, they often reduce their confidence.
Yeah.
But I want to propose something else. There is something that everybody heard of, and people talk about it, called cognitive dissonance. But I just want to repeat kind of a story about cognitive dissonance, so we're in the same starting point. So the story that started cognitive dissonance was this lady who basically said that on a particular date, the earth will be destroyed, and only her followers will be saved, because the aliens will come and take them away, and everybody else will die. And Leon Festinger heard about her, and he wondered how would her followers react the next day when the earth is not going to be destroyed. And for simplicity, he said, imagine two types of followers. On the fence followers, people who don't think she's a real prophet, but say, hey, maybe. So just in case, I'll hang out here for a day, just so in case the aliens come. And there were the diehard followers. And the diehard followers were people who gave up their money and got divorced and joined her and did lots of things waiting for the aliens to show up and to be rescued. And he said, who would be more disappointed? And you could imagine that the people who gave more in will be the more disappointed. Those are the people who now have no money and no homes and no spouse and all destroyed lots of things. But Festinger said that the people who took lots of actions supporting their belief would have a much harder time admitting that they were wrong. And indeed, that's what they saw. The people who were on the fence said, we didn't know she was a real prophet or not. It turns out she's not. Let's go home. The people who gave up almost everything for her woke up the next day and said, thanks to her, the earth was saved. They actually increased their belief in her. They started raising more money. They started recruiting more people. And the idea of cognitive dissonance is, we often think that we have opinions and our opinions drive our actions. But what cognitive dissonance is also telling us, that our actions drive our preferences. That if you go somewhere and you give up your money and you give up your relationship and you do things, your preferences move with your actions. So if we go back to your question about what do you do with your patients, I think that a very important method for getting people to change is to act first, and then your preferences would follow. So, if people are not taking the medication, I would say for the next week, I want you to come here every day at 8 a.m. and we'll take the medication together. You want action first. Now, it's not easy, it's time consuming and so on. But in a world of convincing people, actions are very important. And by the way, it's also very frightening, because if somebody is online and they posted a few things about the lizard people or whatever, now they're more convinced about it.
Yeah.
Right? Because every action is creating, or if people are deciding not to fulfill their medication, not to take the prescription, decide not to, these actions consolidate their preference. So we have to think about actions as a pathway for opinion change and therefore behavioral change.
It's interesting, because when those people do, the few that do realize that they were wrong, they will have to use a little bit of resilience. We don't like to have discovered that we've been wrong, especially about long-held views. There's one last thing I absolutely, positively have to get from you. In your book, everybody, Misbelief, what makes rational people believe irrational things, you talk about your favorite misbelief. My favorite misbelief is this. I'll have a patient who'll come in with a disease that's causing a lot of trouble. Let's call it hypertension. The hypertension is really, really bad. They're having headaches, their kidneys are failing. They'll walk in the door and they will say, "Doctor, I don't believe in medicine. I don't want to take a medicine. Don't give me a medicine." And in the next breath, "We got to do something about this." That same person will be at home and have 13 different capsules of nutraceuticals, different things over the counter, right? And when you ask the patient about why don't you want to take a medicine, what's behind that, right? Getting at, what's your thinking about that? Is it the pill itself? Is it big pharma? No, it's none of that. I don't like taking a pill. Well, then you go through and the medical assistant has already gotten that they're taking 2 times 6 plus an extra 1 capsule. This is a real story of over-the-counter nutraceuticals. Nothing wrong with them. I use them, I prescribe them for the right person at the right time. I think that's a pill paradox, right? I'm writing something about that. The pill paradox has nothing to do, to your point, with the fact of taking the pills, because if it were, you wouldn't take 13 capsules that are bigger than the little pill that is going to actually be more effective. It's the meaning you associate or attach to the prescription medicine. It's hard to get people to elaborate on what that meaning is and where it comes from, to your point in the book. Sometimes it came from your mother. Sometimes it came from what the experience that you got from your grandmother. You saw your grandmother suddenly become so ill that she passed away, but only after she went to the hospital, because at home she didn't pass away. Now, to you and me, we understand the progression, and probably that condition was way far gone by the time she got there, and she died because of the complications of the disease, not because of the medicine that the doctor gave. The reason why people still have that distrust in the medicine or whatever, and they will go and take 13 capsules, which you can't verify what's in there. Nobody's got a liquid chromatography machine at home. We're not doing that, right? That trust that you're talking about, you're trusting that the nutraceutical guys are above board, guys and gals, right, are above board, and that the pharmaceutical guys and gals are not. Well, that's not rational. And so when I come across that, there can sometimes be a little bit of an impasse, especially when I get them to, kind of say it. Little bit of a light bulb goes off, but they dim it down, put a little filter in front of it so you can't quite see it. My fear is that the reason for that has little to do, less to do with the patient and more to do with the doctor. We're trying to sell something. In sales, if you don't make the sale, you don't blame the client, the customer, you blame yourself. I'm trying to sell you freedom from death or unnecessary heart disease from, let's say, out of control blood pressure. If I didn't do a really good job, I got to try it again. I got to make the call again. I got to bring you back again. We haven't, as professionals, I get to say this, we have not taken that, right? On my rounds as a little, baby medical student, ding, 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 we're following behind, the attending like little duckies, ding, 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 ding. We used to say the words, the patient was a poor historian. Wait a minute. In history, the person who is writing the history is the historian. The person who's taking the history down is the historian, not the events that happen. The things that happen is history. The historian is the person who's writing it down. That's what I'm saying. So it's this perspective that if it's not quite right, it's got to be everybody else. I think the same thing with COVID pandemic. I think the death numbers would have been a lot lower had we just said, what's our role? Our role should change. It's a different perspective. Our role should change. If the patient believes something that is not true, it's my job to help them understand. And just because we can't do it easily, Dan, and I only have 8 minutes in the room, doesn't mean it's not my job. And that's the issue that I have. What do you think about a person who would take 13 pills from the over-the-counter pharmacy and not want to take the one pill? What's your thought?
So I think that the first thing is that doctors really have the task of creating trust. And the task of creating trust is not just saying, take this pill. We need to dig a bit deeper and try to make people take trust. Why am I recommending it? How do you make clear to the patient that you don't stand to gain from them taking that pill? Say, okay, here's two possibilities, A and B. Here's the benefit of A, here's the benefit of B. I recommend B, but it's your choice. I don't own stocks in that in that company, but it's basically a question of, do we spend time creating trust? And I think there was a time in medicine where people had trust in physicians. Trust has been going lower, and you need to take an action. The medical field in general need to improve, but you as the direct physician, you have a role to play in it as well, right? So I know everybody's busy, we don't have time in explaining things, but explaining things, here are your options, here is why I recommend it, here is why I'm recommending it, here's what other patients have done before you, here's the reason to do that. So I think that's one important point. The second one is that some pills are an admission of guilt. And here is what I mean. Think about type 2 diabetes. With type 2 diabetes, doctors tell patients, if you don't act well, you'll have to start taking mealtime insulin. If you don't take care of yourself, and I think the same thing is happening in cardiology, where we tell people, if you don't start exercising and eating better, I'll have to increase your dose. I'll have to do this. And eventually, when we get to that situation, society and the person are telling themselves, it's my fault. So that pill, to you as a doctor, it represents improved health. To them, it also represents an admission that they have not done, like there's so many things in medicine that we blame people. I mean, I don't think we do it purposefully. We're trying to increase their motivation. Here's a real motivation for you to eat well and exercise and do all of those things because you don't want this pill. But then when you get to the pill, people are saying, I didn't do my job. But it's not really true. So I think we need to have a more empathic approach to patients. We need to understand that they need trust, and they need to feel that it's not their fault. And one last trick. It turns out that people are more likely to take medications that are not changing them, but restoring them to what they used to be. So if I tell you, here's a medication that would get you to do X% more, you say, do I really want to modify myself? If I say, here's a medication that would get you to how you were 10 years ago, now people are much more willing to take it.
Yeah. No, that's a fantastic point. Dan, I could talk to you for hours and hours and hours. I really appreciate you taking this time today. Misbelief, everybody. What makes rational people believe irrational things? Professor Dan Ariely, thank you again for being on the Health Mastery Cafe.
It was a pleasure, and thank you very much for the time.